Live from the SABC's Auckland Park headquarters. Good evening to you and welcome to this Wednesday episode of the Watchdog. My name is Vuyo Mvoko. On the show this evening, as COVID-19 infections jump to almost 27,000, we speak to the National Institute of Communicable Diseases about what it could all mean. This as South Africans begin a long weekend that also kicks off the festive season.
I took the decision then to place him on medical parole. It's legal and procedural.
Well, the courts beg to differ with the former Correctional Services Commissioner. Arthur Fraser's decision was today set aside. We bring you the latest from both former President Jacob Zuma's lawyers and the Department of Correctional Services. Hours before Umkhonto liberation fighters begin their 60th anniversary celebrations, we will also bring you up to speed with what you may expect tomorrow. But we'll also tell you about another celebration of a different kind. Presidents of two former liberation movements, Azapo and the PAC, today meeting to discuss possibilities. That and more coming up in tonight's episode of The Watchdog, which starts now. While the government is still mum about whether any major decisions were taken at a National Coronavirus Command Council meeting that took place last night, news just in shows that coronavirus infections continue to rise. There were 23,884 cases yesterday with 24 deaths. Over the past 24 hours, 26,976 new cases were registered with 54 deaths. Now, those numbers released about an hour ago by the National Institute for Communicable Diseases, whose public health surveillance head joins us now on the line. Dr. Michelle Groom, welcome back.
Good evening to you and your viewers.
I don't know what, goes through your minds when, especially this week as you're seeing these numbers, not, continuing to rise and rise, situation not getting better at all.
Yeah, look, I think it is concerning seeing the increasing number of infections. I think it was never... We always expected another resurgence in infections, and I think it's really important that people really look towards the hospitalizations and deaths just to see what is happening in terms of this wave, because I think it's very different this time around. I think we've shown that we've got a high lot of seroprevalence, which means people who've been exposed to COVID in the past, either from natural infection or from vaccination. And so we're going into this wave in a much different position to when we were going into the third wave. And so although we're seeing these very high numbers, I think in terms of the number of hospitalizations and the number of deaths we're seeing, there's been a disconnect in terms of how many hospitalizations and deaths we're seeing.
That, of course, by no means, suggests that we should all relax, because the situation may not be as dire as it has been in the past, of course, given the explanation you've just given.
So I think it isn't time to relax. I think it's the festive season. We know that, there'll be lots of people gathering in various places. And so I think really important to still be vigilant in terms of transmission. I think we know that the Omicron variant really is more transmissible now. It does have some way that it can evade our immune system. This is mostly for infections. So we have seen that more people that have been infected in the past are being reinfected, and we are having a number of breakthrough infections amongst the vaccinated. But the vaccine does seem to be, and prior infection does offer protection against severe disease. But I think in the same vein, I think looking towards the holidays, we know what works in terms of the public health interventions. So vaccination, I think for those who haven't yet vaccinated, I think now is your chance to really, get your vaccine, roll up your sleeve. I think we know that mask wearing works, and I think also in terms of gatherings, I think if you're going on holiday, try and, choose less populated areas, try and stay outdoors as much as possible so that we can limit the spread. Because even though we're seeing less hospitalizations, obviously if we're seeing large numbers of infections, we don't want those to translate into any kind of impact on our health systems.
Well, I mean, incidentally, these numbers are rising and rising, at a time when, as everyone knows, today, effectively, is the start of a very long weekend, which also, kickstarts, so to speak, the festive season. People gathering, kissing, and, partying is all going to be, part of the norm from this weekend onwards.
Yeah, I think everyone's tired. I think to have another Christmas taken away from us is quite disheartening. But I think we really just need to be as vigilant as we can in terms of approaching this wave. I think we've seen some early signs in Gauteng that the numbers seem to be stabilizing. Some early indications that Tshwane, where it first started, is starting to see lower numbers again. But I think really concerning with the coastal provinces, I think we saw today very high numbers in the Western Cape, Eastern Cape and KZN. And so I think this is where many of the holiday makers are now making their way. So I think we really just do need to just be cognizant that we're still in the middle of the pandemic. And I think everyone really just needs to, to play their part in terms of trying to curb the transmission and to try and keep ourselves safe as much as possible.
And that's what a lot of people are worried about. If you look at what people have been posting on social media, the fear, of many people is exactly that. People leave Gauteng, which has been, an epicenter, even though, as you've just said, it's beginning to stabilize. Mm-hmm. People on the coast are worried because, how Johannesburg looks, in the last 2 weeks of December and the first few days of January. There's very few people because a lot of people have gone to the coast, to your, KZN, to your Eastern Cape, to your Western Cape. And I think the worry that people are beginning to express, in those areas is that the Gautengers and everyone else are, we're going to be bringing them, problems.
Yeah, look, at the moment, I think the increases did start in Gauteng, but I think we've already started seeing increases in the other provinces over the last week to 10 days. So I think, but unfair to say that Gautengers will be bringing it there. I think it's already started. We know that this variant is really transmissible. We know that we can't really keep it contained within a province. And this was much to do with the travel bans as well. I think it's really not possible to keep the variant out. And so I think really, we're already seeing large numbers at the coast, so it's already there. We're already seeing transmission. So I think really important. It's summertime. I think stay outdoors as much as possible. Try and not congregate on top of each other. Wear your masks in public places. And I think that really is a way to be able to protect ourselves. And as I say, I think vaccination is really important in terms of preventing the severe disease.
Of course, it's not just the sort of coastal provinces that are getting worried because as numbers are increasing in the rest of the provinces that previously, weren't showing such a rapid rise. I was talking to someone from the Free State Health Department last night who was worried that in their case, a lot of people who are now, increasing numbers of people who are getting infected are in fact their frontline workers, which was then also, dealing a blow to their efforts to try manage and, contain this.
Yeah, that's a definite worry, and I think we are seeing the increases in Free State. I think they're kind of getting to a point where they're almost reaching, I think they've passed the peak of their third wave. And I think the impact on the healthcare workers is definitely a concern. I think for healthcare workers, most of them have been vaccinated or been exposed to COVID in the past, but there are many reinfections, and even if these are mild, I think with the present isolation and quarantine requirements, I think this does put our healthcare workers out of action. And I think it's really important that we rapidly reassess some of these guidelines in terms of quarantine and isolation, especially as related to our healthcare workers, because I think there's anecdotally, clinics that have had to close down totally because of lack of staff. And I think it's really important over this period, when many may be on leave as well, that we are able to adequately resource our health services.
Okay, well, we can only hope for the best, at this stage. And of course, we hope that some decisions have been taken that at that National Command Council meeting yesterday that will help, that will go a long way in helping the country cope better. These numbers, as much as not too many people are dying or getting sick, they are indeed worrisome. Thank you very much, Dr. Groom. She is the Public Health Surveillance Head at the National Institute for Communicable Diseases. The NICD announcing that over the past 24 hours, 26,976 cases were registered with 54 deaths. Up next, Umkhonto Wesizwe Liberation Fighters on their 60th anniversary celebrations, and Azapo and PAC presidents on their Dunadere. Former liberation fighters are getting up for a big celebration tomorrow. Umkhonto Wesizwe, the ANC's military wing, is turning 60. To tell us all about it, let's welcome one of the organizers, Tami Ndendeni. Mr. Ndendeni, good evening. Thanks very much for your time. So, what's the plan for tomorrow?
Thank you very much, Vuyo, for the invitation and the opportunity to be able to speak on the 60th anniversary of the formation of Umkhonto Wesizwe. Naturally, I think it is a given fact, a historical given fact, that the formation of Umkhonto Wesizwe on the 16th of December 1961 marked a turning point in the history of the ANC, and also in terms of the methods of struggle that were adopted at that point in time. It was actually a turn to armed struggle. So one wants to say that marking the 60th anniversary of Umkhonto Wesizwe is an important historical milestone, because you will realize that the majority of the first cadres of Umkhonto Wesizwe, referred to mostly as the Lutuli detachment, are now growing. They're not growing old. I think they are old and they are frail, and it is absolutely important. It is absolutely important that, in line with the injunction of the Constitution of the Republic, that We recognize the injustices of the past, and we honor those who sacrificed to bring about this democracy that we enjoy today. So it is in that context that we're marking the 60th anniversary of MK, and also the historical significance of the 10 to armed struggle at that point in time. It is expected that in terms of there will be other events, certain things that may happen there, but I think the keynote address, in fact, the keynote address is going to be given by the Deputy President, Honorable Didi Mabuza, tomorrow.
Now, apart from the, historical significance, you just spoke about, is there a theme or idea that you are coalescing around, at this time?
You see, Vuyo, MK itself is an idea. It is an institution. When we talk MK, we talk of a historical significance, and at this point in time, one could say, Vuyo, if maybe you were to just imagine MK as a human being. In 1961, this human being is born. And in 1971, this human being is 10 years of age. And it is preparing itself for its responsibilities that it is going to shoulder. Already at that time, even at the age of 10, this child already has monumental national responsibilities. And then you say, in 1971, this child is now 20 years. And in the 1980s, this child is ready. Even before that, the child already launches devastating attacks against the apartheid regime. And therefore, only 33 years down the line, when that child has reached the age of 33 years, it achieves the objectives that it had set itself of bringing about a democratic dispensation in this country with the kind of constitution that we have. So when you say idea, I want to think that you don't want to narrow this thing to a particular one idea, because this is an institution that is all embracing. It is an umbrella institution around which a number of other ideas are linked to it. We are talking about something almost like an amoeba here, with tentacles that spread out to various sectors of society, which it contributed towards bringing about. Mm-hmm. So I think I want to avoid just the narrowing down of MK to a particular idea. I think it is that idea of MK as an institution is the national constitutional dispensation that MK assisted, and the sacrifices that members of MK actually underwent so that we are where we are today.
Of course, I mean, the one part of the reason I was asking whether you had a theme or an idea that you were coalescing around this, this time, was because, in notwithstanding that glorious history which you have just described, it's public knowledge that over the years, especially the last, decades, things have gone awry. Divisions have been, we've seen the divisions and, different groups. One, you have a Council on the other hand, you have the MKMVA on the other. My question really was about whether you are making any concerted efforts to deal with those problems, hopefully once and for all.
Well, thank you very much for that question, Vuyo. But I think, first and foremost, we need to put context to this. As of now, as we speak, the National Executive of the ANC has taken a decision to disband both the MKMVA and the National Council. And an interim structure has been established, led by General Zimbande, retired, which is going to work towards unification, if you want to call it that. But from where I stand, and in terms of my own understanding, when you speak of MK and the achievements of MK, I know there are very senior members of MK, Mavuso Msimang, Zolile Nose, Comrade Ronnie Casrills, Mac Maharaj, all of these comrades. I don't think we see ourselves as being divided. We see ourselves as one unitary MK unit. There may well be disagreements with other people who think differently about certain things, but I don't think I have the authority to speak along those lines. Mine is to speak about MK and what it has achieved in 33 years of its existence. That is my responsibility. All these other things about the MK Council and MKMVA, this is not the forum to discuss those things, Vuyo. I think there are people who are better qualified whom you could invite to speak about those things.
Okay, best of luck, Mr. Ndendeni, with your celebrations tomorrow. Of course, the SABC will be bringing you a coverage of those celebrations throughout the day tomorrow. Now, on to a celebration of a different kind now. Presidents of two former liberation movements, Azapo and the PAC, met today to discuss possibilities. Well, they join us now to tell you what their meeting was all about. Mr. Nelvis Kagema, Mr. Mzwanele Nyonzo, good evening to both of you, and thank you very much for joining us.
Good evening, Vuyo.
Let me start with you then, Mr. Kagema. What was the point of this meeting between the two of you?
No, well, it is simple, Vuyo, because first of all, Azapo and the PAC, it's actually two sides of the same coin, you know, two rooms in the same house. And so therefore, we saw that there was a need for the two organizations to come together. And this is not the first time we've done that. Back in 1982, 1991 in Zimbabwe, and then around recently. So we felt that there is a need to work together because we have identified that we are hitting below, our punch. And so therefore there is a need to come together and see how can we maximize, our efforts.
Whose idea was it, or who initiated the meeting?
Well, both of us, we did, but of course, and I would say that we did shoot, because remember, Azapo is fresh from National Congress about last weekend. So from the last weekend, we had a mandate that we need to talk to the PAC. Biko and the Sobukwe need to come together. BC and Pan-Africanism need to come together. We cannot be on the sidelines. We need to be moving. These philosophies need to be mainstream such that they are in the corridors of power. It's unacceptable that we have done so much. I mean, look at 21st March, Sharpeville Day for the PAC. Look at 1976, the Black Consciousness Movement, and yet we are not near the corridors of power. We are not near, fighting for the land. We are not near fighting on the side of our people. So we needed to beef up our muscle, and we can do that if we come together as these two organizations.
Now, presumably at your conference last week, you would have done a great deal of analysis to look at how you got where you are right now. Did you do that? And if so, what was the outcome of that exercise?
We did. We look at ourselves as Azapo, and we said the first thing we needed to do is to wipe out the negative stereotypes associated with the organization, the smallness, inactivity, divisions, and so forth. And then we then said, to be able to do that, the first thing to do would try and introduce a rewiring of the organization. We needed to introduce some mindset shift where we are able to introduce young people in the leadership. We take that, it is a risk, but we need to take that risk, put them in there, young as fresh. And if you look at the deputy president, she's about 28 years, and all the others are in their 20s. And we are saying, these are the people to go. We need these fresh ideas. We need the people to rock the boat. We need the people, to wake up Azapo from their slumber. We need to turn Azapo into an action-oriented organization in a manner that Steve Biko did, in the manner that Musibudi Mangena Pandela Nefolowodo Sets Cooper did. And that can be done. And then we believe to do so, we need to work with others because we cannot achieve that alone. This is a big task. And that is why we are saying, let us work with organizations like PAC, but we should not wait only before or on the eve of elections. We need to work together right now, and a united front that would be able to fight for our people, fight for services, defend our people when they're attacked by racists, and deal with issues that undermine the integrity and the dignity of our people, like the bucket system that is still there, like the pit latrines that you see still there, our people being thrown into the lion dens by white racists to be devoured by animals. That cannot happen when these organizations, big ones with all this history, are there and doing nothing. We need to come together. That's what we're saying. We pull our resources and flex our muscles together.
Mr. Nyonso, I'm hoping that line has stabilized now. Let me bring you in here. What for the PAC was the point of the meeting you had with your Azapo counterpart?
Thank you, Vuyo, and thanks to the viewers. Firstly, it was to congratulate my comrade who has just been elected as the Azapo president, and we've known each other for quite some time. And secondly, we believe that we are family. Azapo and PAC are family. So we met as children of Sobukwe, as the children of Steve Biko. And it was important for these two organizations, at least for now, to meet as president and see how do we work together going forward, and also try to fulfill what our forebears started. Remember, it has always been about the land. So we had to touch a question of land. We had to say, in our lifetime, we need to fulfill this mission. We need to liberate the people of Azania. So that was very important for us. And of course, for now, it was just brainstorming and meeting as leaders of this organization. In fact, where we are very happy.
Well, I mean, flowing from this initial meeting that you've just had, how do you see it all unfold?
Firstly, from here, because today we met as presidents, as you correctly put it, the next thing we'll do, we'll go and talk to our executives and also get buy-in from our national executive councils. And from there, we'll take it slowly. We must commemorate events together. For example, Steve Biko's Day, Sobukwe Death Day in Graaff-Reinet, 21st March, June 16, we start co-hosting events together, and we'll have leadership from both sides sitting and discussing these working relations going forward.
I mean, I'm sure you two have done your own analysis. You've looked at the players in the political space, you know, old and new. You've probably identified corners that you can begin to occupy in more meaningful ways than perhaps has been the case up until now. Have you done any of that, and do you have any idea as to where exactly you are going to begin? And I'm talking now about the bigger political space outside of your two political parties. Is there space for your organizations to begin to...
Yes, there is. Remember, from here, from meeting with the leadership of this organization, we will have to go to the people. We'll have to take these organizations to the masses. Remember, Sobukwe taught us that we must show the light and the masses will follow. Now we will have to go to every corner of our society and tell them that these two liberation movements are waking up. It was just a question of waking up these sleeping giants. Otherwise, people out there are ready for PAC, are ready for Azapo, are ready for us, and they are happy. In fact, when we mentioned that we are going to meet, we could see that people now were pushing us, they were telling us that you must meet and this is what you must discuss. We are looking forward. We are waiting for the results. We are waiting for the program. Come to the masses, come to us. And we have received very, very positive response from both sides, which means people are out there, are waiting for us. People out there are thirsty for these two liberation giants, and the time for this mission to be fulfilled is now. We, as Frantz Fanon said, we must fulfill this mission or betray it, and we have agreed that we are going to fulfill it. We are not going to betray this mission.
And Elvis, I mean, from like looking, same question, from like looking at the body politic in South Africa currently, where would you say, or are there areas that you've been able to identify where you think, for lack of a better word, and often used expression is low-hanging fruit? In other words, where is your entry point?
Our entry point is to go to the people. Remember, Sobukwe described members of the PAC as illiterate and semi-illiterate as the key core and cornerstones of the struggle. The question is, the people of this country were always aware that PAC and Azapo are going to be the answer to their problems. But we had our own challenges. And now that we have resolved those challenges, and now we are talking as these two organizations, people now are going to get confidence. And once we go to them, people will just follow, will show the light.
Okay, Elvis, for you, where do you think that entry point is?
Well, that entry point is to first look at constituencies like young people, for instance, who are completely marginalized. Now, people, if you look at if you're looking at even the unemployment rate, it's hitting them very hard. And then if you're looking at when it comes to education, they are marginalized. They have to fight what our people died for in 1976, and they're still fighting for. They have to form new organizations like the Feast Must Fall, when they have their fathers and mothers and grandfathers and fathers, running the country. And you've got to look at women. For instance, if you look at women, how they're marginalized, still being treated as, as minors in a sense. And then they still, if you look at the feminicide, what is happening, how they are killed throughout the country, how, for instance, even men, when a man is fed up with life, men just decide that, I need to kill myself. I'm not going to leave my family behind. So he kills children, kills the woman and everyone, and then takes himself. So these are the kind of things that we need to address. And but we've got to go to our people when it comes to service delivery. It is not acceptable that our people, and it's only black people who live in Mikuku shacks. Why? Why are we the only people? Why are we the only people? Using a bucket toilet system. Why? Why is it not used by other people? Our dignity is at stake.
Mr. Nyonto, quick comment before we end this. We have run out of time, but I received emails, a couple of them today, from one Narias Moloto, signs off as PAC president, who, upon hearing that I was going to host you this evening, sent me emails, and among them is a letter that says you are not a member of the PAC and you are not the president of the PAC. Your utterances do not represent the PAC policy and position. Quick response from you?
You still take those love letters from him even after the court has declared.
Well, that's exactly what we told them. But if you could just restate your position for the sake of our viewers.
The position is that the PAC has been declared by the North Gauteng High Court. The position is that the PAC as elected in Bloemfontein is in charge of the organization. The position is that as the PAC were also in charge of IEC processes, the position is that we contested elections, and for the first time we performed and we received more than 100% from what we received in 2016. 23 councillors nationally, and we are represented in all metros that we contested. So the PAC is in charge. The PAC leadership is in charge. But I hope the SABC will just stop taking letters. Everyone can just write a letter and say this one is expelled, this one is expelled. It doesn't make sense, and it's really boring for us to be talking about same person. Even if he heard that I'm invited to a tea by some family, writes to that family and say, don't invite that family, that man. I'm trying to show the level of madness that this man has undergone. So please, it's not about what we want. It is not in the interest of the PAC. It is not in the interest of the South Africans. It is not in the interest of Azanians in particular. And now the bottom line is that we are building this party. We are taking shape. And we've made a call to everyone who wants to repent and come back and rebuild the ship of freedom, PAC, the organization of Sobukwe. That's all I can tell you for now. At least you are clear, you know what is happening.
And that's where we're going to leave it this evening. Thank you very much, and best of luck to both of you on what you have just started. The presidents of the PAC, Pan-Africanist Congress, and of the Azanian People's Organization. They have just met, looking at areas of cooperation and how they can work together and advance the struggle. After the break,
then to place him on medical parole, it's legal and procedural.
With the Pretoria High Court now saying that decision was unlawful, what now for former President Jacob Zuma? Has today ordered that former President Jacob Zuma returns to prison for the completion of his 15-month sentence. It ruled that former National Commissioner of Correctional Services, Arthur Fraser's decision to place Zuma on medical parole was unlawful. This follows Zuma's sentence for contempt of court after he refused to continue to appear before the Commission of Inquiry into state capture. Fraser released the former president on medical parole against the advice of the Medical Parole Board. The court declared that the time Zuma was out of jail on medical parole should not be counted for the fulfillment of his sentence. Zolega Kodashe compiled this report.
The judgment that has divided the nation. While some have hailed it as a victory for the rule of law, others have questioned the purpose of the judgment. However, it's not yet the end of the road for the former president. With now limited avenues at his disposal, Zuma's legal team has launched an appeal against the judgment.
The legal team of His Excellency President Zuma has just delivered its application for leave to appeal in terms of Section 17 of the Superior Court Act on the grounds that the judgment is clearly wrong, and there are strong prospects that the higher court will come to a totally different conclusion.
The court ruled that the decision by former National Commissioner of Correctional Services, Arthur Fraser, to place Zuma on medical parole was unlawful, and that Fraser had no legal basis to undermine the authority of the Medical Parole Board that advised against granting Zuma medical parole. Judge Elias Matujane said nothing that Fraser relied on asserts that Zuma is terminally ill or is physically incapacitated, requirements that should be met before medical parole is granted. Zuma was released from the Escort Correctional Services facility in September, prompting the DA, Helen Suzman Foundation and others to launch a court bid against the decision.
Obviously, we're very happy. Obviously, it's not a good thing that somebody goes to jail, and it's not something to celebrate, but I think what we can celebrate is the fact that the rule of law has been upheld in South Africa and the principle of equality before the law. And I think the judge's findings were scathing of the conduct of Mr. Arthur Fraser and very clearly set out how this was a deal done because Mr. Zuma was connected with people within the ANC. And I think it's a very strong message that's gone out that all are equal before the law. And it doesn't matter if you're a former president or an ordinary citizen, the rules will apply equally to everybody.
A stance the EFF disagrees with.
Arresting Zuma is nothing but political revenge. If the law must serve a purpose of rehabilitation or bringing order to society, what is the purpose of arresting Zuma again? How is Zuma a threat to society, or what need is there to rehabilitate him? It's malicious use of the law. The point is that he must be corrected. And in this case, it looks like there is a clear mandate to punish as opposed to correct.
Meanwhile, some Durban residents say they are concerned civil unrest may break out again in KwaZulu-Natal should the former president return to prison. Many fear a repeat of the widespread unrest in July that claimed 350 lives in the province and Gauteng. However, Zuma's application to appeal will stay the High Court's order that he return to prison. The decision to appeal means Zuma will not be going to jail until that application is heard. Zole Gakutashe, SABC News, Johannesburg.
For some analysis and perspective, let's welcome Ntabiseng Dubazana, who is the director at Dubazana Attorneys and a legal commentator. Good evening, Ntabiseng. Thanks very much for your time. I want to start with something I saw on social media. Some people asking, Gandhi, aren't these courts, taking leave? Aren't they supposed to rest? Fact of the matter is that there was an application, there was a court bid, that was launched by your DAs, your Helen Suzman Foundation, and others. This is not, the court having a go at Jacob Zuma.
100%. In actual fact, today was the last day for courts. Courts are going into recess starting from today. But be that as it may, this was an urgent application. Urgent applications, as the definition itself states, it was launched well before courts were done. They had basically like 7 days to make sure that everything is compiled, and then a date was granted to them. So it's not a matter of, we are gunning for Ndate Zuma in any manner or form. An application was done, it had to be heard, and the date was given prior to courts going on recess. Pertaining to the appeal that's coming, however, it will have to be heard next year. As said, that the matter is not, I beg your pardon, the courts are now going on recess starting from today.
Now, the former president's spokesperson says their legal team has delivered their application for a leave to appeal. What exactly does that mean in very, in layperson's terms?
Okay, so leave to appeal is to ask a higher court to look at the facts that were laid upon in front of the previous presiding officer, which is the High Court for today, and then ask them to look at the facts laid before then and the judgment that followed, and see if they cannot come to a different decision. In other words, when you ask your mom for something and mom says no, then you go and appeal to grandma, and grandma might overrule. That is the simplest way I can think of giving an example with that. So this is what we're looking at, asking the SCA to look at the decision that was done by the High Court and see if they can come to a different decision based on the judgment that was given today and all the facts that were put before the High Court today.
Okay, that's, of course, I mean, from the former president's a point of view. I want us to take a listen to what the Department of Correctional Service had to say after starting that judgment. Here's their spokesperson.
The decision taken by then, was confined within Section 75 of the Correctional Services Act. And there were other facts which were brought before the court when the matter was argued there. And having studied the judgment, clearly, a number of those facts were not considered according to our opinion. Hence, then they moved to say we have to appeal this particular judgment.
I know you say that it's still too early to ask you this question, but I can't help but ask, does this have anything to do with, as you say, that with Section 75, the amendments that we then saw over the years when it comes to the requirements of parole? Because, according to the Act, it's not only about terminal illness. There's other factors that may come into play to make sure that you place somebody on medical parole, and having tightened all the loose ends. Are you maybe using that particular amendment to that Act as a possibility here?
There is quite a lot of detail that was involved before that particular decision was taken. And also, why are we citing Section 75? There's also other sections which are relevant. But how do you treat inmates who are serving 24 months or less, who has the jurisdiction to preside over, matters involving those inmates? And what are other relevant prescripts within the Correctional Services Act that must apply? So you have all those details that you ought to then crystal, put them through, present them, and make sense to the court why we arrived at the decision that was taken by the National Commissioner at the time. And having studied this judgment, we do feel that there's a number of facts which were not considered, or perhaps maybe that the judge felt that maybe it's matters which were not worthy to be considered. Hence, then we are saying it will assist to take this to a different court, maybe make a different conclusion there.
Now, Tabi saying, before I ask you to comment on that and make your concluding remarks, I just want to remind our viewers of what Arthur Fraser himself said here on the program about that decision, why he took it, and what he was relying on.
Recommendations were made to the Medical Parole Board, Advisory Board. And those recommendations were made, yes. And the recommendations were that the board did not approve for medical parole because they indicated that he was in a stable condition. What I need to indicate, when the Medical Advisory Board provided those recommendations, I had then, the head of the center, who has the authority to decide, then reviewed the information available and then indicated that the conditions, based on all the reports that we have, require us to release the former president. I then rescinded those delegations because it's original delegations that's with me that I had delegated to. I rescinded that And I took the decision then to place him on medical parole, and I'd given a host of reasons. The reasons is available, it's in documentation, and it will be presented to whoever need to see that. I'm sure Parliament will be asking to
I'm confident it will stand whatever scrutiny.
It's legal and procedural.
Tabaseng, what do you think of what the reasons are what Arthur Fraser said there, and also, of course, what the spokesperson of the department had to say before him? All of that, of course, on the back of the president's legal team going to appeal.
Well, when we look at what the judgment was saying, when I read a bit of it this afternoon, there are wordings that the judge was using when looking at the various reports that were submitted to the medical board. For example, that the health of Dr. Zuma had deteriorated significantly. The interpretation, for example, of that word significantly, the presiding officer today was not of the opinion that it meant that he deserves to be placed on medical parole. Such wordings whereby it is the medical board agreed that there is that Zuma has a lot of comorbidities. However, he is in a stable condition, therefore he doesn't fall within the ambit of persons that are terminally ill. I beg your pardon?
Well, I was going to say, unfortunately, we're going to have to leave it there. We have run out of time. I'm being harassed. Apologies for that. Hopefully, we'll find time to explore these issues further in future. And that's our show for this evening. To join us again tomorrow night, 8 p.m. sharp. Good night.